Everybody on Twitter seems to be dishing out health advice, and most of it should go in the bin, like this one. But there are some that require a bit more thought, and this tweet by Alex Hormozi did get me thinking, so I wanted to talk about it in this video. First of all, the tweet is, sadness comes from a lack of options, which is why it feels like hopelessness. Anxiety comes from many options but a lack of priorities, which is why it feels like paralysis. Looking everywhere but moving nowhere. Solve sadness with knowledge and anxiety with a decision. So there's a lot to unpack there, and I think this really gets to the heart of anxiety and depression and the logical side of the brain and the emotional areas of the brain and how they can be dysfunctional in mental health issues. So I'm Jack, I'm a doctor in the UK, and I've just been working in a mental health job, and I've seen so many patients with these conditions, and I think this tweet applies to some of them, but not all of them. And so I think it's a really interesting one to explore in this video. So stick around to learn a little bit about the neuroanatomy of the brain and some psychological frameworks that might help you with mental health issues. So let's get into this. Anxiety is a function and not an error. So we have anxiety for a reason, because we're trying to avoid getting physically or emotionally hurt. So it's really beneficial in many, many contexts. But anxiety can also become pathological. And I think the easiest way for me to say it is either we have functional anxiety that is evolutionary, very helpful, and then we have dysfunctional anxiety, which is where that has become no longer helpful for us and starts to limit us. So I found this diagram on the internet that I found insanely helpful to visualize this. I think the important thing about this diagram is it shows that there's two pathways of anxiety through the brain. There's the shortcut and there's the high road. So the shortcut goes straight into the emotional areas of the brain, like the amygdala and the limbic system. And then the high road goes up into the logical parts of the brain, like the neocortex, which is where we can apply context. So if you imagine you're walking down the street, you've got somebody behind you who you can't see, but they're walking quite close to you. I have this all the time. And the emotional part of your brain goes, what if that person's got a knife? What if this person's trying to mug me? And then you go, actually, what is the likelihood of that in this area of town? And start to apply some logic to the situation. As soon as you turn around and see it's an old lady, then you feel really stupid. So what's happening there is the initial response is going in the shortcut, but then we can go into our neocortex, apply some context, and then dampen down that response, because we're like, okay, calm down now. We can apply logic to this and actually it's all okay. So when I was looking through the literature online, the really important part of this is people with dysfunctional anxiety, like we were saying at the start, have a reduced ability to apply that logic and to go on the high road. So the high road needs some roadworks doing on it, and it's not working properly at the moment. So bringing it back to the tweet, why does that matter? Well, what Alex Hormozi is trying to do is to apply logic, and he is taking us up the high road into the neocortex. And some people with really severe mental health issues aren't able to go up that road. Therefore, applying logic to their mental health issues and saying, well, you've got too many options and a lack of priorities. Well, that part of their brain and that road is not working properly. Therefore, they're stuck in the shortcut with the emotional parts of the brain completely taken over. However, I do think this could be incredibly helpful for a lot of people.
I started 4 businesses that cracked 10 million in a row.
So Alex Hormozi is a businessman. He has probably noticed this in a business context. For example, if he's got a deal that he needs to do or somebody that he needs to fire and he is not doing it, then that's going to cause anxiety because he's got many options but a lack of priorities. And then by just prioritizing something and doing it is going to help with that anxiety. So in those contexts and with somebody who has that high road fully functioning, then absolutely this might be really helpful for them. But my point is that it might not be helpful for everybody. So now let's step across into the depression part and see what we think about that. Sadness comes from a lack of options, which is why it feels like hopelessness. Solve it with knowledge. So I tried placing this into some context. So for example, in my clinical practice, when somebody has just been diagnosed with cancer, that is a horrible situation to be in. And both them and their family members are going to feel terrible about that. If you provide them with lots of different treatment options, whether that's surgery to remove the primary, whether that's chemotherapy or radiotherapy, all of those different options that you can provide them with, hopefully provide them with some hope that this situation can improve. So in that context, yes, I think their knowledge of that is helpful. However, some of that knowledge is really, really specialist. Therefore, not all of that knowledge you can gain yourself. So I think in a lot of contexts, having more knowledge and more options is really helpful. But at the same time, sometimes more knowledge can be a burden in medical context because you realize all of the different complications. And that's why doctors make the worst patients, because when you know all of the complications, all of the things that can go wrong, as well as all of the things that can go right, sometimes knowledge can be a burden as well as being a good thing. But also the same thing applies, like we talked about with anxiety, when that sadness becomes depression. When somebody is no longer taking pleasure in activities they used to enjoy and having low mood and low energy for more than 2 weeks, that's when we would class that as depression. I found Steve Peters' chimp paradox a really, really good psychological framework to help explain this to patients. Steve Peters says that basically the chimp paradox is 3 different internal forces that are battling it out between each other. And those 3 forces are the chimp, the human, and the computer. First of all, the chimp is our emotional part of our brain. It's the part of our brain that comes out when we're playing sports and we just completely lose control and just go full emotion. The human is the logical part of our brain, which is what Alex Hormozi is appealing to here. And the computer is the automated processes that we have within us that we can train. For example, Steph Curry throwing up a basketball shot, that's just his computer doing that because he's trained it so much. Often what can happen in mental health issues is the chimp can become the dictator within our minds and can completely take over. I find that really helpful because it's a psychological framework of you can say, who's in control here? Is logic in control? Is my emotional responses just completely taking over? And I find that really helpful personally. And when I've explained that to patients, some of them have found it really, really helpful. We've talked about how, the emotional side of our brain might have completely taken over. Therefore, the logic of this tweet no longer applies. So what do we do in those situations? Well, if that is you, then you should definitely seek support from your doctor. They can give you antidepressants, they can give you advice, they can refer you on to psychotherapy, because there are so many different interventions now that can help you. So if you are suffering at the moment, then please seek some support. I think this tweet does apply in some contexts, and you should definitely use what works for you. So this might not apply to you whatsoever and you just discard it. Whereas for me, sometimes I do find this a helpful logical framework to say, am I sad because I don't have enough options, or am I anxious because I've got lots of options but no priorities? And that can be really helpful for me in some contexts. So if that could be helpful for you, please apply it to your everyday life. And that's really what I'm looking to do on this channel, is to take something, whether that's a psychological framework or a scientific framework, and to give you some tools that you can apply to your everyday life to live happier and healthier. So if you like the idea of that, then please subscribe and let me know in the comments down below. Do you find the emotional part of your brain sometimes takes over, the chimp taking over from the human? Just let me know in the comments down below, and I'll see you very soon. Thank you.